Hi, I'm Dr. Hagmeyer, and today we're talking about why your gluten-free diet hasn't helped you. Right? Maybe you've read a book, and the book talked about all about the different diseases and the different kinds of symptoms that gluten can cause or contribute to. And you just figured that getting off gluten would be just a good thing to do, right? So maybe you went on this gluten-free diet after you had been diagnosed with, let's say, irritable bowel syndrome or lupus or rheumatoid arthritis or even thyroid disease. And you heard that gluten was just bad for people with autoimmune diseases. So you went into your cupboard and you started throwing out the bread and the pasta and the rice and the pretzels and the cookies, and you went to the nearest Whole Foods store or other grocery store and you replaced all of those foods with certified gluten-free cereal foods and various snacks with the little red label on it that says certified gluten-free. Right? You followed this gluten-free diet for 3 months, 6 months, 3 weeks, and much to your disappointment, you saw very little improvement, and perhaps your health even deteriorated a bit. Right? Did the diet not work for you? Did you get the wrong diagnosis? Is a gluten-free diet just another fad like so many other diets we've seen? Why did it work for your next door neighbor and your friend, but not for you? Why were they able to see changes so quickly, right? And so these thoughts are probably racing through your mind, right? They went through your mind, and if that hits close to home, then in the next 10 or 15 minutes, I want to share with you really and explain to you why this change didn't bring about the positive results that you had hoped for, right? So about 6 weeks ago, I began working with a new patient who had been diagnosed with celiac disease about 10 years ago. 6 months ago, she had been newly diagnosed with something called Hashimoto's disease. She had a history of rheumatoid arthritis. She lives in chronic pain, and for the most part, she's exhausted all the time, right? Sounds like a lot of people out there. She completely eliminated gluten. She almost never eats out. She's incredibly committed to her health, right? But her GI doctors can't figure out why almost every colonoscopy that she's had since being diagnosed with celiac disease continues to come back where there are inflammatory changes in her gut and in the intestines are not healing. Unfortunately, even with this diagnosis of celiac disease 10 years ago and a very, very earnest attempt at eliminating wheat and rye and barley, preparing her own meals, not eating out, she is still struggling with all of the same symptoms of constant fatigue and chronic pain and brain fog and daily diarrhea and overall states year after year. If she was to look back, she's getting sicker. Right? So why is this patient, who has clearly done such a great job at eliminating wheat and barley and rye from her diet, why is she not better? Maybe you have a child at home and you've noticed the same thing. Well, I recently came across a study that showed that 40% of children on a well-managed gluten-free diet for 1 year still had elevated antibodies to gluten. So what do we make out of that? What's going on here? Well, why are people not getting better, right? One of the potential reasons is something researchers are calling antigenic similarity or cross-reactivity. I'm going to explain those to you today. Now, based on our biological individuality of our body's immune system, a person with celiac disease and even non-celiac gluten sensitivity can have an immune system reaction to any number of gliadin or gluten proteins. So let me show you what I mean by that by showing you her test. Right? The patient here, again, has eliminated gluten, eliminated rye. She's followed the same guidelines that many patients who have celiac disease follow. She doesn't cheat on her diet. She eats super clean. And what you see here is that she is reacting to many of the different subfractions found in gluten that A, are not tested for in conventional testing, and B, are often the culprit of why people who go on a gluten-free diet, why their mucosal lining is in a continuous state of inflammation. The other thing we see here is that why patients, despite their best efforts, don't improve on a gluten-free diet. Now, again, if you look at this test, you're going to notice wheat is normal. Alpha-gliadin, gamma-gliadin, omega-gliadin, these are all normal. And if we had stopped there, then that would be a good thing. Unfortunately, there's much more to this picture, and if that's all that was ever tested, we would say that our job was done. However, this test sheds more light on the picture. It allows us to look at how the body is reacting to many of the other protein fragments, and if this was where the real trouble lies. Notice how this patient is reacting to everything in the pink region. If anything lights up on this test in either the pink or the yellow region, you need to further investigate. Right? There could be Things like accidental exposure. Again, this is where or when someone uses the same cooking surfaces or the same utensils as other family members. It might be a situation where foods that were labeled gluten-free and they were possibly stored in containers and bins or became contaminated with gluten-free foods. And then another possible scenario is this cross-reactivity. But before I explain cross-reactivity, I want you to take a look at this study that in part talks about why patients with celiac disease, why they never get better. Now, if you look here, it says in this study, they took 465 patients. They put them on a traditional gluten-free diet, and after about 16 months, they looked at biopsies, and what they found was that out of those 465 patients with celiac disease, 26%, all right, so that's 121 patients, they had absolutely no change, right? So the conclusion of the study was that normalization of duodenal lesions is exceptionally rare in adult celiac patients despite adherence to a gluten-free diet, right? So that's so disappointing. Out of 465 patients, 121 of them had no change, right? Now, if we look at the conclusion, however, you'd walk away from this and say, see, gluten-free diets really don't help. They don't work. But hopefully, after today, you'll see that there's much more that meets the eye and how recent research supports what I'm about to tell you. Now, the reason I wanted to show you this is that the shortcoming of this study, I believe, lies in the definition and the criteria of what a gluten-free diet consists of. You see, most GI doctors will say that a gluten-free diet is simply eliminating wheat, rye, and barley. And I believe that this study would have been very different if the definition of a gluten-free diet took into consideration the antigenic similarity between gluten and many other forms or many other proteins that are found in grains. All right, so now let's talk about what this antigenic similarity is, also known as cross-reactivity. With cross-reactivity, your immune system recognizes shapes and the sequence of amino acids found within various proteins in your body. So as you eat these foods and you break them down in your gastrointestinal tract, these proteins are being broken down into smaller amino acids. Well, your immune system determines whether or not that amino acid sequence is similar to gluten. All right? Now, for someone who's gluten sensitive, the immune system has become highly sensitive to the shape of the gluten molecule. And so molecules with similar shapes, say for example corn or rice or milk or oats, that may cause the body to launch into the same immune reaction to the foods that it would if you were eating gluten, right? So take a look now at this patient's test results, who also on a gluten-free diet. And what you see here is a bunch of foods that this person has been eating and the immune system's response directed at that particular food. Right? This is what we call cross-reactivity, and it's this cross-reactivity that I believe is a very common culprit in many cases of or conditions where people are struggling with thyroid disease or irritable bowel syndrome or diabetic patients and many patients who are suffering with different kinds of autoimmune diseases. Okay, so what are the symptoms you might experience with this cross-reactivity? Well, in some people, because of this ongoing immune reaction, you might experience things like diarrhea. One person might have diarrhea, another person might have constipation, a third might have bloating. You might have ongoing anemia or low iron levels, right? No matter how much iron you take, you always have low red blood cells, you always have low hemoglobin, you always have low ferritin, all right? Some people may feel perpetually fatigued and experience brain fog. Others may feel or experience eczema and psoriasis and skin conditions, all right? And no matter what they do, they don't go away. Basically, what you have going on here is you could have all the symptoms that occur with a person who has a gluten sensitivity, all right? So what do you do if you have this gluten cross-reactivity, all right? Well, a couple things. One, you have to look at certain tests. And so what do you do if you have a test that looks like this, right? You need to eliminate these foods for 4 to 6 months, sometimes longer, depending on the clinical picture. And you and your functional medicine doctor needs to work on supporting and healing any functional problem related to the health of the gut. The next thing you need to do is you need to introduce these foods very slowly, and you need to introduce them over a period of several weeks or even sometimes several months. What's very important here is that you journal how often you're eating these foods, and I don't recommend that you eat these foods more than 3 times per week. All right. The reason why you want to journal the frequency of these foods is that if you're eating some of these foods, for example, say 3 times a week, and you don't get a reaction and you retest, then this food is safe for you if it comes out in the normal range. Remember, we're not using how we feel as the indicator of whether or not food is safe, but what we do want to see is if there's any kind of correlation between the results of the test and the symptoms experienced, and if there's a reaction. Okay? Now, this is something, again, your functional medicine provider is going to help you with. Right? The next step you want to do, and this is really the most important step of all, is you need to retest. Retesting, I should say, becomes very important because it determines whether or not your body continues to have an immune reaction to the food. All right? Don't think that just because your past symptoms have not returned or you're not experiencing stomach problems and fatigue and skin problems that you're out of the hot water just yet. All right? So again, the sequence looks like this. You do initial testing for baseline data, you eliminate these foods, you reintroduce these foods, at the same time you're journaling the frequency and any reactions that might be occurring. And then finally, you're now retesting. In my opinion, you cannot base whether a food is safe or not safe based on whether or not, again, you have that reaction. And here's why. It can take a few days, it can take a few weeks, and sometimes it can take a few months before a certain threshold is met, and now you develop those symptoms. Right? Now, an immediate reaction on reintroduction of a food may indicate that you have a food allergy. But what we're talking about today are food sensitivities. This is the IgA and IgG portion of the immune system. Okay? Now, the other thing is that many nutritionists and doctors, I believe, are missing this point because they're looking for that immediate reaction. Now, the thing I want to stress to you is that, again, remember that these tests are monitoring IgA and IgG levels. Okay? IgA and IgG, these are delayed food sensitivity reactions. These are not allergies. These are not your IgE. Right? These tests tell us nothing about allergies. So it's very important because, again, that distinction is where I think a lot of people are getting hung up on expecting, upon reintroduction of these foods, to have an immediate adverse reaction, and that's just not going to be the case. If you're interested in testing, you can learn more about testing on my website. I'll leave a link in this video description. And most importantly, if there's any questions you have, feel free to comment in the section below, all right? I try to do my best to answer them. I can't always answer every single question, and from time to time, every couple of months, I'll go back and I'll answer those questions. But for the most part, I hope today's video helped clear up some of the confusion that surrounds what it means to be on a gluten-free diet, how gluten-cross reactivity could be one of the sticking points for you. And of course, most importantly, hopefully you have a better idea of how to remove and then, of course, reintroduce these foods, and of course, when to retest these things. Hope you found today's video helpful. If you did, make sure you subscribe to our YouTube channel, comment below. Remember, sometimes you need to just dig a little bit deeper before we find those answers. So again, hope you enjoyed it. Take care.